I'm gonna call some of the highest qualified people in the room. I went to school. Those of you, some of you might be surprised, but I did go. Uh, I went to school. Nigeria, I went to UCT grammar school, hidden campus. There are people that are found in res. When I got there in 1996, I graduated 1998. They were still there. I went back 1999 for another degree. I left. They were still there. Uh, but fortunately, most of them today are doctors. So they've done their time. I'm sure the next gentlemen are going to engage us, ladies and gentlemen. You can see how they're dressed. Some of you might have guessed. Some of you probably think, "Giddy male nurse." They are not. They are not male nurse. These are fully qualified doctors. Please give them a round of applause, ladies and gentlemen. We're now going to have a dialogue with the Gentleman's Clinic. Those of you who may not know him, Suhail Esa is one of the funniest comedians in South Africa, ladies and gentlemen. And they are here today. They've given us their time equally. And I will ask him to please introduce the rest of the team. And then we can have this dialogue. I don't know if we're going to need a mic for the audience or I should give you guys all three
I
mics.
think that's at the end. We'll do a Q&A.
Oh, okay, sure. All right. Please give them a round of applause, ladies and gentlemen.
All right. Good afternoon. My name is Dr. Suhail Esa. I'm one of the directors of the Gentleman's Clinic. We are a fully virtual online consultation platform dealing primarily with men's health issues. But I like to think of us as specialists in male confidence restoration. The majority of the issues that we actually are seeing on our consultation platform is actually erectile dysfunction, premature ejaculation, and hair loss. And based on what we've heard today, David, we've got some slots available for next week. We know why you're wearing that cap, so the Mbandla is strong. So we've also got a podcast, the Gents Clinic podcast, and the aim of the podcast is to change the perception of men's health in this country. And together we all discuss certain issues that we face within our jobs and what we see in our day-to-day lives. And we also discuss our own personal problems. And in that way, we try and relate to men and bridge this gap between us as medical professionals and you guys as the general public. So let me fully introduce myself. I am a doctor. I work in the emergency medicine department. That's my field of interest currently. I'm also a stand-up comedian, and I'll allow the others to introduce themselves. Nhlanhla?
Hi guys, how are you? Good. So, like Suhail has just said, I'm Nhlanhla Vilakazi, or Dr. Nhlanhla Vilakazi, and I'm one of the executive members of Gentleman's Clinic. And obviously, primary interest being mental health, men's mental health, as well as obviously the medical sort of associated problems that we feel men need an outlet or need a place where they can discuss with other men. My current interest, or where I'm based, I'm actually currently specializing in ophthalmology, which is eye surgery or microsurgery. And that's what I do most of the time.
Hi guys, my name is Dr. Naseem Sharif. I'm also a medical doctor at the Gentleman's Clinic, and I'm mainly interested in internal medicine and in HIV management.
Hey, I'm Vishay Naidu, one of the other doctors here in Gentleman's Clinic. So I'm actually specializing in urology. For those of you who know what it is, I'm actually one of the Mtondo doctors. So apart from that, we also deal a lot with kidneys and bladders as well. But yeah, I think a lot of our background also comes from that. But yeah.
Oh. Tondo doctor. Hi guys, I'm Dr. Brendan Matthews, the real one. Yeah, I've got a letter from HPCSA and WITS to confirm. So it's there in my bag if anyone wants to know. But thanks. Thanks. Yeah, I'm mostly a primary care physician, so I deal with everyone at the ground level. And so if you come see me, usually if you come to the place where I work, besides the gentleman's clinic, I'm the first person you'll see and the first person you interact with. And I think that's very important, and we'll talk about more about that in this chat. Okay, thanks.
All right, so today we're actually here to discuss mental health, and later in our discussion we'll discuss how that links to what we do. The first question that was asked to us is, what is mental health? And mental health is actually the emotional, psychological, and social well-being, how it affects the way we think and act. It determines how we handle stress and relate to others, and how we make healthy choices. Specifically, we'll discuss a few of the mental health disorders that we commonly face in South Africa. And the four main types are mood disorders, anxiety disorders, personality disorders, and psychotic disorders. The most common ones that we face are the anxiety, depression, and also some of the mood disorders, which I'll hand over to Dr. Sharif to just explain or give us the definition of.
Yeah, so we should know what they each mean. So like anxiety is mainly the feeling that you get when you worry about something in the future. It's that worry, that stress, that feeling of unwell, right? And then stress is the feeling that you get in the situation at the moment, right? So that's like between anxiety and stress. Then there's depression, which is this basically low mood, right? So low mood, there's a long list of different symptoms that are classified under low mood. So you have like anhedonia, which is the things that you enjoy, you no longer enjoy. Then there's you can't sleep at night. There's you don't have any appetite. You don't have any energy. So that's depression. And then there's what other ones?
Mood disorders.
So like mood disorders, like we always hear bipolar. Sometimes you even insult someone and say, no, you're just bipolar, or like you're always changing. But bipolar disorder is like there's two types of bipolar disorder, right? So it's usually a swing in mood. So if someone sometimes they feel like high mood, they're very elevated, and they have so much energy at a time, and then all of a sudden they change instead of low mood, and they feel depressed and have these periods of cycle all the time. Yeah, so the type 1 would be mania and then depression. Type 2 would be a little bit of happiness and then a lot of depression. Okay.
Just to add a bit on what Nash said, well, obviously explain stress and anxiety. I just thought it's very important to also understand that with the patients that I have mostly seen, especially men, is that we tend to see it a bit more different. It's rare to actually see gents coming with low mood or problems with sleep. Majority of the people we see or I see personally come with they have this, they're very irritable, they're very demanding, and you find that there's actually a lot of tension as well. I do a lot of emergency work as well, so you can also see quite a lot of tension with the family, bad communication skills with the family. These people are there to get help, but they're so eager to leave. The family is also quite fragmented. So we see it a bit differently, and like Dr. Jerry just said, what happens is that it's easy when you see the family structure to actually analyze some of these signs and symptoms of depression.
Yeah. So next we're going to discuss a little bit about like what are the actual signs clinically and physically. So clinically is the things that we pick up, and physically is the symptoms that you may experience. So I think I'll hand it over to you guys.
Yeah, so just I think also going back on that, as mentioned before, with denial as well. A lot of the history might, patients might be in denial, but a lot of the physical examinations, which obviously we look at on patients and things like that, you're able to, put a few scenarios together in which you may be able to make a diagnosis of certain, like psychological illness or depression or anxiety. So again, like on our clinic, a lot of the presenting complaints might be, like low energy, lack of sleep, or unable to eat. And then a lot of these patients may also present, with erectile dysfunction or premature ejaculation. So a lot of the times it's also in young gentlemen where, there's no actual other medical comorbidity, which, you can attribute to this problem. So it may be due to anxiety, where they've been in this previous situation and now it just leads to a worse and worse cycle where, that they're with their girlfriend and they just think, is this thing going to happen again to me? And I think each time it gets worse and worse and worse. So at a point now, before the act even happens, they're sitting and thinking, what can I do to prevent this? So I think a lot of the times, a lot of situations, these are the type of patients we encounter on our site as well.
And Dr. Jerry mentioned something very important. Sometimes what the body shows is a reflection of what's going on in the mind. Okay? And we're speaking about presentations. How will you see these things in yourself? Men, there's something a colleague of mine said, men, we've been taught in South Africa 2 ways of communication: anger or happiness. That's all. And sometimes they present ourselves with showings of anger in different ways, whether it's GBV, whether it's against friends, and expressing yourself because you can't cope. We don't have coping mechanisms, is what we call it. We call it coping mechanisms. And so we present, you would come to a doctor complaining of X, Y, and Z, whereas you yourself don't know that this is actually because of a long history of mental health problems within me or social ills that are presenting themselves in this way. So we want to empower you to recognize these things in yourself. Nasim did mention sadness, but sadness is relative. And you might not pick it up in yourself, or you might want to compensate it. But the feeling of things that I used to like, I don't want to do anymore. I just don't have, we call it lists. We don't have lists in Afrikaans to get up and face the day. Get up and go to work. Get up and do things, daily chores, even looking after yourself, I think I heard David earlier this morning speaking about just getting a haircut. Once someone is starting to neglect themselves, and hopelessness is a very important one. When you start having these 3, and then you find at night you don't sleep either, insomnia, you're heading down a terrible path and you need to seek help. Because insomnia related to symptoms of depression is a very, very high red flag for suicide, for ending up at suicide. Let me stop there because I'll end up talking too much.
So I think what's also important to understand is that we all go through levels in life of stress. There are going to be stressful points in time in our life. There's going to be times where we feel sad or low. But once it starts affecting your social or occupational function, meaning at work or with the relationships that you have with the people around you, that's when you need to start considering seeking help. And at that point, if you don't have proper mechanisms to de-stress or to find a way around the feeling of a low mood or anxiety, that's when it'll become a problem. So I think that leads us to our next point, is how can we prevent getting to that stage where we may need to seek help or where we've now got an actual mental health disorder? Guys?
All right. I mean, most of you guys need to give yourselves a round of applause for even attending such events, because this and it shows. It says a lot about you. It says you take mental and your own personal mental health very seriously. You know that mental health actually matters. So I mean, already you've done probably 50% of the work. Number two, personally, I mean, for what Siv has done outside, and I feel like these guys actually, they know what we all need, and they sort of put up the program in that manner. So making sure that there's exercise, there's fitness, you take care of yourself. I mean, those things mean a lot. And for me personally, whenever my colleagues say to me, Doc, where do you find time to lift weights with those arms? I always say to them, so you're telling me in 24 hours, well, we don't really have 24 hours because you're sleeping, but in 24 hours, are you telling me you can't give yourself just 1 hour to be in your head, to be in your thoughts, to develop yourself, and just align yourself, and think, okay, what have I done today? What was positive? What was negative? How do I, better myself tomorrow? And exercise at the same time, punch things. So that's what I think fitness and exercise is actually for. Besides, obviously, the other physical gains that you'll get and the health benefits. And lastly is being able to talk to people, having, friends like this, being able to have an outlet where you can cry and sort of having those kinds of spaces with the people around you, I think matters a lot. I don't know if you want to...
Yeah, I just wanted to, I was reading a study that said Viagra is as good, exercise is as good or better than the use of Viagra. So if we understand... No. So, but what's difficult is that we are people, we are society who looks for instant gratification. We want a pill, You would be surprised how many people we consult where we clearly can see in this consultation that this person, all he needs is lifestyle betterment, exercise. How many of you felt better when you came from downstairs there? Yeah. Look, see all the hands coming up. So leave the blue pill. Let's go get the gym.
Yeah, I think. Sorry.
Yeah. So just as these guys were saying, you hear it a lot. They say the best cure for depression in men is just to go to the gym. If you have any low mood, go to the gym is the first thing. And there's a lot of lifestyle modification that you can do to improve your mood. We see things commonly like vitamin D deficiency. If you're dark skinned, you need to have more time in the sun. Simple things that can completely change your mood. Imagine feeling depressed and having a low mood for something simple as not going to the sun. We nowadays spend most of our time indoors, right? So spend enough time outside. Also, folate deficiency can cause a low mood. So eat a lot of red meats, these green leafy vegetables, right? Get enough folate. There's vitamin D, folate, and low testosterone, right? Check your testosterone levels. It might be a thing that is causing you to have a low mood, right? And also iodine. If you have hypothyroidism, you might have iodine deficiency. So these are simple lifestyle modifications, diet and exercise that can change your mood.
I don't want to take anything away from the social aspect. You can treat high blood pressure as much as you want. If you don't deal with the social aspects, it won't be sorted. So I don't want us to say that Gentlemen's Clinic, we are forgetting that we have problems in our society, in our township, of drugs, of unemployment, of poverty, and all of these things affect our mental health. But we want to try and give you the tools as much as possible to do the little that you can and teach the next person as much as you can, to use the space that you have as much as possible.
Yeah, and then I think that leads us to our next discussion point. Currently in South Africa, it's a very well documented stat, and in fact, globally, that male suicide rates are higher than women by a long shot. And the methods in which men choose to commit suicide are violent in their nature. Hangings, shooting themselves in the head, jumping off a building. Men don't see an outlet. Men don't even cry for help. It's not like guys are, trying to overdose and kill themselves. They want to get the job done. And they don't feel like they have an outlet. So I want us to just touch a little bit on the stigma in society and the limitations that we have in South Africa currently around mental health. Vish.
So I think, just reflecting back on those stats. So men to female suicide rates are at least 3 to 4 times as many. So that's obviously of completed suicides. Females do have higher number of parasuicide, which means suicide attempts. So obviously the conversion rate is a lot lower in females. And as Sohail mentioned, generally of less violent caliber. So again, like how do men go down this path, without even seeking any help, without anyone knowing that they have depression or anxiety or any mental health disorder, before they get to this end point, which is obviously now suicide. And I think, just looking back on it as, this idea in our head is that, men are there to be the providers, men are meant to be the strong person in the family or the sole provider for your entire family, and I think especially now, in our economy and things like that, if you aren't able to provide or you're having it with difficulty, if your wife or partner is now unfaithful, you have a lot of, psychological stresses surrounding you in your close circle, in the people that you see every day. You may also not have the social structures and support, friends, close family around you, who may pick up on these signs, as mentioned before, to say, look, I think, maybe I've noticed this pattern in your behavior has changed, and I think it's best, you should see a doctor. So a lot of this doesn't actually happen, and the man might feel all these symptoms for quite a while before now saying, I actually don't have any option, I don't have any choice. You might see your friend you see maybe once or twice a month, and looks like they're having a brilliant time, they're going out, they're partying all the time. Your life doesn't look like that. They may be driving fancy cars, going out to like fancy places, and your life doesn't look like that either. So a lot of it does come down to comparison as well, where you just might feel as a failure in life. And in your imminent future, you feel like there's no other way. There's no way you can improve. There's no outlet. And you might feel this might be the only way to get out of this. There's no one to talk to. You haven't sought any medical help. From what you are aware, none of your peers or family members or any men you know of have ever complained about this. So you also will feel like, I think it's not normal to complain about these problems. So I think that's something which obviously does why we're here as well today, is that it is normal for men to bring up all of these problems, and to seek medical attention, or even if you confide in your closest friends and family, it's something that's why we're here today, to obviously recognize these problems and be able to confide in your loved ones.
And let me just quickly jump in there with regards to the limitations we have in South Africa. So I work in the emergency department. I'll give you guys just a quick example. We work in a very resource limited setting. 9 times out of 10, who here has ever been to a government hospital for care? Right? I'm sure most of you, if you've ever visited the emergency department, it's a mess. You're waiting like 4 to 6 hours. You're probably sitting on a bench. There may be no beds for like sometimes 24 hours, 36 hours before you end up in a ward. Now I'll put you guys into the eyes of someone who's now actually taken the step to come and get help. Had a guy who came in, he's lost his job. As a result of losing his job, he's lost his partner, who says, you can't take care of me, so I'll go get a better man. He's now come there saying to me, I'm going to shoot myself. I want to kill myself. I see no option to get out of this. My family, my wife is gone. My child is gone. I have no income. I'm useless to society as a man, because that's my main purpose is just to be a provider, and I've lost that now. I want to die. Can you help me? And I look back and I see a sea full of people. There's no benches, there's no chairs. And I say to him, well, I can, but you're going to have to sit here and wait. You may have to sit here for 4 to 6 hours before a psychiatrist sees you, before you get admitted, and then you'll be in an overcrowded ward with maybe 20 other psychiatric patients who are shouting at you. You know, it's a very difficult situation to be in. And then you have down the road, you've got like a KISO and other, private psychiatric facilities where you'll have to pay like 250,000 if you want to be admitted for a week. So, I mean, it brings us, back to what we are actually providing. And we at the Gents Clinic, apart from all the services that we do provide, one of the things that we do, help men with is, if you need someone to talk to, book a consultation. We can at least try. You can at least have someone to talk to. We can work you through your problems. We can refer you to the right facility. We can be the buffer that you may need before you get the help that you really, really need. And I think that's very important.
Signs are there in someone that you think wants to commit suicide? What signs were there in the person who committed suicide months or years ago that you knew? Probably no signs, right? And I'm going to give you a tool that we all were taught, but we probably don't use it as much as doctors. Ask the person, ask anyone, ask your friends, ask your family, ask your colleagues, those close to you. Make it a normal thing to ask you, do you think about killing yourself? Randomly, ask them. It might sound scary. If you ask your daughter, my child, have you thought about killing yourself? And she says yes. Or maybe she doesn't even say, the thought that she might say yes scares you. But you need to ask that question, because if you don't ask, you won't know. And then you find your relative hanging from the roof. And how does that feel? How are you going to feel when you know you could have asked? So that's also a reminder to all of us. Please make it a normal thing. Please, this is a serious thing I'm saying. If anything was a joke, this is serious. Ask, make it a normal. Have you thought? Have you tried? Do you want to? Please do.
And I think finally, before we open the floor up to questions, the last point that we want to discuss is what not to do when you feel like you're in a difficult situation mentally. What are the things you shouldn't do? What are the outlets that men usually take to try and curb their stress or curb their depression that you should not do?
So some of the obvious ones, I always think of or always advise anything that gives you instant gratification. Sex, alcohol, anything that's going to make you happy now. Just know you are not dealing with the problem. So if you just approach it that way and you look in your life, what are the things that are going to help me better and sort of better understand my problem, or better discuss this problem, or better address these issues. And trust me, there's a lot. I mean, you have your church groups, you have counseling groups, even in the townships you have that. You have platforms like Gentlemen's Clinic, which is virtually, it's online, it's on your phone, it's, you have literally no excuse. Okay, maybe some bit of cash. But yeah, so instant gratification, stay away from alcohol.
Promiscuity, stay away from that. You're not going to find the answer between a woman's thighs, I'm telling you. Well, we do treat STIs as well at the Gents Clinic. So yeah, I think that's what we kind of wanted to just present to you, a little bit of insight into mental health. And we're happy to open up the floor and get you guys to ask us whatever questions you are, even the most uncomfortable ones. Ask us and we'll be happy to assist. So let's pass the mic around.
I think, Nasim, I think Dr. Nassim was about to say.
Oh, sorry.
So it's just a point on coping mechanism, right? So a lot of us, we go the wrong way. You're feeling stressed, you're feeling anxious, but then you do something to mask that problem. And you just make the problem worse by not actually attacking it and solving it. So like a lot of also what we do in medication, we give like serotonin reuptake inhibitors, right? So SSRIs. And just as Ntate, Jerry was saying, these are like placebos, right? So there's recent studies that were showing that like they had like a big study in Nature where they were comparing SSRIs versus a placebo. They checked 17 studies and they had 2 people review all these studies and they said that there was no difference. It was the same thing. So your help, the only way for you to get better is self-directed. You know the reason why. There's something that's causing the problem. Be responsible and take it at the head.
Up to now, ladies and gentlemen, I think round of applause for this gentlemen that are here and that have taken their time. My brother, your first question. Let's try and keep them short so that we can have time.
Greetings.
It's
To the Dr. Mtondo. Because now I'm quickly running to the toilet, and there's a problem. Whenever I'm with other guys, they always finish before me. I seem to take longer urinating. So I'm going there now. I'm going to take a lot of time. I need an answer on that. Why is that? I'm taking longer than other guys every time.
But in the bedroom, very quick. Okay, let's do 2 questions and then let the doctors answer.
Thanks so much, guys. I love what you guys are doing. My thing is that I do a lot of work in life saving, and kids are drowning because people see in the films how drowning looks in films. People see heart attacks in films, and they think, "Oh my God!" I think there's a responsibility for people. I'm in the film industry that when I'm doing a film, I'm like, "No, bro, drowning is silent. You don't hear someone drowning." And I think people see depression in films, and they're like, "Ooh, the Dark Knight. There he is, that's depression." And I think people in the film industry have a duty to be able to create content that is actually truthful to what happens in the real world. Because people watch movies and the kid's drowning and he's going, "Help!" But you can't go help if you can't breathe. You know what I mean? And heart attacks, I had a friend of mine who had a heart attack, he drove himself to the hospital. He felt guilty. I just feel like people here, as much as we're all educated individuals, I still think we all have a preconceived notion of what depression is. We have a preconceived notion of what erectile dysfunction is, because it's not like your dick's not working entirely.
Yeah.
But it's not as hard as it used to be. But a lot of people see these things and they don't have these symptoms, that the content needs to give us the right content. And I think it's important for us, even to you guys, to be able to simplify it to its dumbest form. So us men who've been watching films our entire lives can be able to unlearn. So I think, yeah.
Thanks for the comment, Doc. Okay, let's maybe get that answer for now.
Okay, so cool, man. Thanks for your question. So again, it depends on what the problem might be. Okay, so there can be some anatomical abnormalities. So if you think about your bladder as a reservoir for the urine, you have a pipe which is your urethra, which now has to synchronously work with your bladder to release that urine. Okay, so basically from the bladder to the tip of your urethra, which is the tip of the penis, there's your prostate. If you have a large prostate, it can cause problems where you may have delayed emptying or incomplete emptying of your urine. Okay, so generally that occurs in older males, so older population. Generally younger population, it can be due to urethral strictures. So if you think about that pipe, which is now partially occluded or partially obstructed, generally this is secondary to either trauma or previous STI infections. You can also have urine flow which is not as strong, or basically you'll take a longer time to empty your bladder. There's another thing which is called, where there's no actual anatomical abnormality, but it's more of a nerve pathology or a problem with actual bladder muscle, which is called the neurogenic bladder. Generally, those are people who have diabetes or poorly controlled diabetes or any spinal cord injuries. in which case that can obviously affect your nervous system. Generally, yeah, so infection with like STIs in younger gentlemen. But most of the times it's, as you get older, you might feel, the urine is not coming as strong. Normally it used to, land there, but now it's actually dropping at my feet. You may also feel like I'm pissing, and then it's like it's stopping, then it's carrying on, then it's stopping. Then you might feel like, okay, when I go out of the loo, now I need to go back there in like 10 minutes time. Or you might feel, geez, I can't even hold this urine for, so I get the urge and then I have to like run there. So these are mostly symptoms which is related to like a large prostate, or even an infected prostate, or inflamed prostate rather. But these are generally classical symptoms of what we call BPH, which is benign prostatic hyperplasia, which is just essentially an enlarged prostate. But again, it's important, obviously, as Dr. Jerry mentioned, to, at a certain age, you do know that you're meant to get a checkup. You do know that you're meant to get a PSA level, which is your prostate-specific antigen, in which situation, so I'm specializing in urology. Your urologist might end up doing a prostate biopsy for you. Okay, and again, as mentioned, knowing who you are, if you have a family history of prostate cancer and things like that is very important to know as well.
Let me just quickly answer Sib's question. So here, us at the Gents Clinic, we are also trying to inform people about the basic common issues, such as the one he may have mentioned. We're trying to cover as many topics that affect men as we possibly can. One of them is mental health, definitely, because it's a epidemic in this country. So the way in which we are doing that is by our podcast. So we have the Gents Clinic podcast, and we discuss all of these issues. Because, we are all doctors, but at the end of the day, we're men. And we like to structure our podcast in the way in which, when you gather with your friends, how you discuss these issues. But obviously, we are doctors, so we are going to give you guys the right information. And I think it's funny, it's informative, and it's a way in which we can get our message across to everyone. Yeah.
Okay, we really are running out of time. So I'm going to allow the gentleman maybe to ask his question as number 3. What we can do is 4, 5, 6, 7, 8 can become the first 5 people to ask the question when we go into the breakaway rooms. But we definitely have to move quicker. So, Posa Kupa,
Thanks. Am I audible?
Yeah.
Okay, cool. 2 things, I'll say them very quickly. I find that a lot of times, one aspect of mental health that we hardly ever speak about is personality disorder. So a lot of people suffer from skewed thinking, behavioral patterns that a lot of times lead them to self-sabotaging and this stigma that you're a shitty person. But a lot of times this behavior is a response to past traumas or whatever the environment and. So how do we help those people? So for instance, if as a person I feel like, why am I making such bad decisions? Why am I having these weird thoughts? Where do I go for help? But as people around them, how do we assist them? Second thing, very quickly, I once read a book by a guy who survived suicide. He said one of the most difficult things he experienced in his journey to recovery was reintegrating himself back into society. So how do you sit and talk to people about mundane things when everyone around you knows you wanted to die? So my second question is, how do we then assist the people around us who have experienced or attempted suicide and are trying to reintegrate back into society? Thank you.
Okay, let me just quickly answer the first one. I think if anybody else wants to answer the second one. With regards to personality disorders, as we mentioned in the beginning, with any mental disorder, once it starts affecting your social or occupational function, that's when you actually need to seek help. And generally with personality disorders, a lot of the time, the people that are suffering with them don't have any insight into the fact that they have it. And so generally, it's the people around them that will, say, this guy needs help. There's about 9 different personality disorders. You can have narcissistic personality disorder, but hey, you may just be a shitty person, Some people just have to accept that they may just be shitty people. But for example, if you're a very narcissistic person who only cares about themselves and nobody else, and it starts affecting your relationships around you, then you should seek help. But if it doesn't affect people around you, you're a very confident person who gets things done, you may be deemed narcissistic, but it doesn't mean you have a disorder.
Just to add a bit more on that, personality disorders, firstly, are very difficult to diagnose. So even as yourself, you might just find that maybe there's, some things that you don't like about a certain person, maybe behavioral issues or whatever, and you might find that it's actually not even a personality disorder. But I think Suel pointed it out nicely that once you start noticing that it's affecting their work performance, it's affecting their not social life, but maybe their marriage and their kids' relationships, then you can maybe start telling them, I think you might need help. They are mood stabilizers. So there's actual treatment that for personality disorders, if your mood is a bit, off or there's certain things, but there is treatment that you can get for that. And I think just quickly on the second question, I think Dr. Matthews also covered it. We need, as men, to normalize some of these chats. I mean, has anyone ever said to you, have you ever thought about killing yourself? I mean, already, even when he talks about it, it just feels so, it's like, what do you mean, right? But it's those kinds of discussions we need to start having. We need to normalize just asking, bruh, have you ever thought of killing yourself? Just randomly when you're chilling and you're having drinks. I know it's very deep, it's very random, but those kinds of questions of how are you doing, how are you finding things, how are you coping with X, Y, and Z? I think that's what we need to do.
And I also want to add, so in terms of personality, there's people who are high in neuroticism, right? So that's the personality type that are more prone to anxiety. I mean, I think for women, they call it a history on people can be over-exaggerating some small things. But the answer to both your questions is something called CBT, cognitive behavioral therapy. Like what you think, like you need to recognize your thought patterns. So you think that other people think that they're always thinking about whether I am thinking about committing suicide again, but it's actually not the case. Most people don't actually think about you as much as you think about yourself. Do you know what I mean? They mostly think about themselves. So CBT is what people go to get through both of these things: personality disorders and what you mentioned was stigma, right? So it's recognizing the thought patterns and how those are actually not true. Because in most cases we suffer more in anticipation than in reality. In reality, it's actually not that bad, right? So you realize that problem, and then all of a sudden, once you train it out, you can reduce it.
I think you can add quickly,
Okay.
Dr. Messi.
At university, a friend of mine from Mashlabatin in KZN, I don't know if this is true, but he said that when someone commits suicide, they whip the body before they take it off from being hung. That was very shocking to me. But of course it's a cultural belief that I think we need to move away from, because when someone says that they tried to commit suicide and now they've survived, we might have a stigma against them. Hey, this person is a weak person, he's selfish, he's X, Y, and Z, and we're whipping that person that they're alive instead of that, whipping them metaphorically while they hang up there. So it's also us, the way that we respond to people who have survived suicide. We need to welcome them back and understand them and accept them and support further.
So, thank you very much, doctors. One more time, I think round of applause. Thank you.